Okay. I attended an interdisciplinary meeting on the oncology unit at Maimonides Medical Center. And the people who were in attendance, so we had the nurses, we had about four RNs. There was one attending, leading the whole discussion. There was about four residents. There was one fellow, one social worker, and a case manager. And the purpose of the meeting was to communicate and collaborate between the disciplines so they can prioritize the best care for each patient. And overall, I felt that the meeting was very effective, just for the simple fact that um, there was a good camaraderie in the group. You can tell that they've been working for maybe a couple months. Everybody was comfortable with each other. The residents, the attending, the nurses, they were all attentive of each other. They weren't dismissive. One instance, there was a relatively new nurse. She was like a young girl, and she had a question about one of the PIC lines. One of the patients had a PIC line, and it was regarding TPN, whether it goes in the distal port or proximal port, and she just had like a quick. She needed to be clarified real quick, and the resident jumped in and answered her question, without judgment, like, oh, this girl doesn't know what she's doing, and she felt comfortable enough to ask the question, so that stuck out to me. They were all very attentive, so that stuck out. Overall, I think it did meet its goal because for each patient, they had a clear outcome of what they wanted to do, and the goal was set. And one case which I found interesting, there was a 55-year-old male patient. He was an undocumented immigrant from Guatemala, and he was diagnosed with small cell carcinoma. But his issue, he didn't have any health insurance. So, so yeah, he lived here with his stepson, and the rest of his family was back home in Guatemala. So the only support system he had was a stepson, and he had one friend from church who was visiting him at the hospital. So Maimonides is a private institute. So the dilemma here was, how was he going to pay for his chemo? They wanted to do chemotherapy and radiation. So the attending, he led the discussion. They were throwing ideas out there. How he's going to pay for treatment. So the nurse suggested that to see if he can qualify for emergency Medicaid. So the social worker stated she was going to look into it to see if he can qualify, which is a pretty lengthy process. It takes about 3 months to become qualified. So most likely what they were going to do, they were going to have to transport him to Coney Island Hospital, which is a city hospital. So they would have to pick up the bill. So I just thought that was interesting, how they were all throwing ideas out there. It was unfortunate that the man didn't have insurance. Hopefully he did qualify for emergency Medicaid, because to turn someone down, for chemotherapy just for the fact that they can't pay, it's sad and inhumane, even though, Maimonides is a business and they can't be, paying for people's treatments. It's a sad thing to see. So hopefully they work that out. But they did have a clear plan of what they were going to do. The social worker was going to get on that immediately because he was just admitted, I think, 2 days or 1 day prior. So they wanted to get that straightened out immediately because they wanted to aggressively treat this cancer. But it was effective because they had a plan in place to see if he can qualify for emergency Medicaid. If not, they're going to transfer him to Coney Island immediately so they can start treatment. So overall, I felt the meeting was very effective.